In this video, we're going to talk through how to correct a swayback posture and some cues and things to work on throughout your day to try to teach your body what a neutral posture should be and to counterbalance that the effects of the poor posture that could be causing back pain, hip pain, pelvic floor dysfunction, and a lot of other issues. So swayback posture is when instead of standing up and having everything line up through your side view, what that ends up looking like is your hips jut forward, your shoulders drop back and usually drop down, and you end up like this. So you can see this is the side of my hip joint and this is the side of my shoulder joint. And now my hip joint is significantly farther forward than my shoulder joint, which is not ideal posture. Can lead to a lot of pinching in your lower back, poor issues with core stabilization, and sometimes too much pressure down on the pelvic floor. So it could be causing a lot of other issues or making other symptoms worse. So what we want to do, looking at a side view is the best way to counterbalance this. We want to think about stacking our body. And so when we talk about that, we have some points that we want to try to line up and stack on top of each other. The first point from up above is going to be your ear. The second point is going to be the center of your shoulder joint, so you can feel where the ball of the shoulder joint is and go right in the center. Same thing for the hip joint. You find that bony part of the hip that sticks out, that's the center of your hip. And then down here, this bony outside of your ankle, those are the 4 points we're going to try to line up in any posture correction. So in this swayback posture, reminder, our hips are jutted forward, which usually has our head drop down. So we end up with this kind of zigzag pattern with those 4 points instead of being nice and tall. So if you're here in the swayback posture, the first thing I'll have you do to self-check is to look down at your feet. Now, without moving any other part of your body, just drop your head and look down at your feet. You can kind of hold your shirt firmly against your belly if you need to. Now, when I'm in this posture, I look down, I can barely see the tippy toes of my shoes. So I'm not seeing very much of my foot at all, or none at all, depending on how swayback you are. Yes, having a little bit bigger of a belly will impact that, but generally speaking, most people should be able to see the part of their shoe where the laces tie. Or if you have different types of shoes, it should be where the tongue of the shoe is, or where the crease of this ankle joint is. Right in that vicinity is where we want to be able to see. So if we're in swayback posture and we just look down, I don't even see my feet anymore. We know that we need to cue our body to shift our hips back. So the first thing you're going to do is try to bring the hips back until you see the tying of your shoe or that front crease of your ankle. Once you're there, keep your pelvis where it is, and then just lift your chest up tall. So you're thinking about somebody pulling a string up through the top of your head, and your breastbone here is lifting. Now you can see that my 4 points are now relatively in line with each other. It's not perfect, but it's better than here. So now we're here, nice and tall. I see the front part of my shoes, and I know I'm lined up better and stacked. What you'll also feel is that your weight shifts back towards your heels a little bit. When you're in a lot of swayback posture, you'll feel a lot of pressure underneath the ball of your foot or around the toes. So if you feel it in the front half of your foot primarily, like you don't have much pressure on your heels, that's another indicator that you're in this posture and you need to correct. So you're going to feel that shifting back of the weight towards your heels. You're going to start to see the front of your ankles, and then you're going to lift up nice and tall. That's the biggest component to correcting the swayback posture. The other piece that some people need to work on as well is that when we're here, our pelvis tends to be rolled back like this, and our lower back tends to arch quite a bit in this posture. So sometimes when we get back stacked up and tall, that we still have this bit of a arch here, and the belly kind of sags forward still. So yes, we're lined up, and yes, we have taller posture, but we're still got too much of an arch here. So what I want you to do in that case is to soften your tailbone. So your tailbone is down here. Think about your tailbone getting heavy and letting your pelvis rotate underneath you. So I'm just taking it from here to here. And when you do that, you should feel a little bit of your lower abdominal muscles kicking in to help facilitate that and hold that posture, which is ideal. When we're here, our lower back muscles are constantly firing or can get overly tight, and so that can cause some of that back pain. But if we do this and we engage more of that front core, we take that back out of the arch, then these lower back muscles get to relax more, and that can really help with symptoms. So sometimes you just need to stack. Sometimes it's just a matter of seeing your shoes and shifting your weight to your heels and getting tall. And some people need to add that extra component of dropping the tailbone down to create a level pelvis this way. So if the pelvis is tilted this way and you get that lower back arch, you can see it's actually going down. This is the front of my hip, this is the back of my pelvis, front of my pelvis and back of my pelvis. You can see is tilted down, versus if I soften my tailbone just a bit, now we're level. What you want to be cautious of it if you're doing this correction is that you're not overly doing it. Okay, we don't want to be walking around with our tummy really gripped and our butt really gripped super tight, because that's not ideal, that's not comfortable. But it's just a very soft release here. You feel a little bit of core engagement, but it's not like you're trying to grip as hard as you can with your core. So those are the basics of how to correct a swayback posture to help relieve any symptoms you're having. So keep an eye on that throughout the day. Check in with yourself, checking at your feet and seeing where your weight is on your feet and checking your pelvis position.